All right, and let's continue the conversation with Dr. Jenna Mendelson, a licensed psychologist with LeBauer Behavioral Medicine. I know we just kind of heard about one family's plight with it and how they deal with it and how they overcome. But when someone hears the word autism or on the spectrum, they may think they understand what it all means, but what do those terms really mean?
In order to meet criteria for autism spectrum disorder, people have to have impairments across two domains. They have to have difficulty with reciprocal social interactions. This can mean difficulty with the nonverbal elements of social interactions like eye contact, gestures, and body language, as well as difficulty maintaining reciprocal conversations and difficulty initiating and maintaining relationships. That's one category. They also have to have difficulty with restricted and repetitive behaviors, which is really a big umbrella with a lot under it, but that includes things like sensory interests and aversions, repetitive use of toys and other objects, hand and body mannerisms, unusually intense interests or unusual preoccupations, and non communicative use of speech. Those characteristics have to have been present from early in childhood. It's a developmental disability that begins at birth, so we expect to see it from early in childhood. They can't be better explained by a different diagnosis, and we expect that characteristics show up across settings, even though they may show up a little differently depending on the situation.
Okay, so that kind of gives us a broad overview of autism and on the spectrum, but what is it not? What are some of the misconceptions maybe that we should set straight?
Unfortunately, there are quite a few myths about autism spectrum disorder. One is that people with autism can't have meaningful relationships with others, don't want to have relationships with others, or don't feel love. This is absolutely untrue. Individuals with autism are very capable of forming lasting, meaningful friendships and romantic partnerships. They may go about this differently. This myth likely arose due to the difficulty perceiving and responding to social cues that can make forming those relationships more challenging, but still absolutely possible.
Okay. How common is autism? I mean, I think we hear a lot about it now, but like how common is it to have families who have a child or a person, a loved one in their family with autism?
Well, like you just said, the CDC recently released an updated statistic that autism spectrum disorder occurs in 1 in 36 8-year-olds in the US. That's about 3% of the population of 8-year-olds. So it's common. Odds are most of us know or love somebody with autism spectrum disorder and most likely interact with somebody on the spectrum most days, whether or not we know that.
And it is a spectrum. So, I mean, there could be, it's variable of how much they do this or they do that.
Absolutely. One expression that I heard once and really like is that you've met one person with autism, you've met one person with autism. They are unique individuals who can present very differently from one another.
At what age should the symptoms of autism develop or start appearing?
Well, autism spectrum disorder is a lifelong developmental disability that is believed, and we have substantial research to indicate that it begins at birth. There are some fascinating eye tracking studies that have been able to distinguish infants who go on to develop autism from those who do not from as early as 4 months of age. So it's there very early on, and often characteristics become observable even within the first year of life and can become reliably diagnosable easily before 2 years.
And that may not be something that a parent, though, like, clues into. So we're going to talk about the signs that parents and caregivers can be aware of when we come back. We're going to continue this conversation after the break. Welcome back. Dr. Jenna Mendelson, a licensed psychologist with LeBauer Behavioral Medicine, is joining us today. She's talking about autism and autism evaluations. All right, so we kind of stopped at this point in the last segment. What are the signs that parents or caregivers should be aware of?
If your toddler is not meeting developmental milestones within the expected time frame, that's a red flag. This can be especially in the case of language, children who are slow to develop language, children who have a language regression where they do develop some language and then one day they just stop using it. That can be a red flag. or children who develop language but don't use it to communicate. So, for example, they might know all the words to their favorite scene of their favorite TV show, but they don't know how to ask you for things that they may need.
Okay. All right. So when should someone consider an evaluation for autism? And is it just for children?
No, autism evaluations are available for individuals across the lifespan. They are a crucial gateway to accessing services and therapies that people may really need. Most insurance companies will not cover services under an autism diagnosis unless a medical diagnosis has been given through a detailed evaluation. And this includes for children who have been evaluated and received an autism designation within the school system. They still need to go through an evaluation process with a medical provider.
Okay. Well, let's talk about that then. What does that medical evaluation process include? What is it like?
It is a detailed multi-step process, beginning with a detailed developmental history. For young children, this is fairly straightforward. The examiner will want to meet with caregivers to ask detailed questions about the child's childhood and developmental milestones and characteristics of autism. For adults, this can be a little trickier because the examiner will have to find someone who knew you when you were a young child to complete that interview with. That's the first step. Then there's a packet of questionnaires. Typically for multiple raters, we have to establish that those characteristics are there across settings. So this is where there will be some screeners for autism spectrum disorder. We also have to establish that it's not better explained by a different diagnosis. There will typically be screeners for other diagnoses as well. There will be a lengthy in-person appointment during which cognitive testing is administered or developmental testing among very young children, as well as a measure called the ADOS, the Autism Diagnostic Observation Schedule. This is considered the gold standard semi-structured behavioral observation for autism spectrum disorder. It is a key component of an autism evaluation. It is only a component. It has to happen in the context of all these other pieces. So if you are somebody looking for an evaluation and the provider only does an ADOS, that's a sign that it's not the best evaluation. Or if the provider doesn't do the ADOS or only gives you a questionnaire, those are signs that it's not a great evaluation. The last piece is a feedback session. These are typically an hour long, during which you get all the results of all of these measures, any diagnostic conclusions, and recommendations based on the results of the evaluation.
Okay, so this evaluation is going to take days, and it's not going to be one of these quick and easy types of things. So if someone says, well, we do this and we think that that's fine, you need to get a second opinion to make sure that you're hitting all the parameters that you're supposed to hit.
Exactly. It's detailed, it's a process. This is a lifelong diagnosis that needs to be thoroughly examined in order to be diagnosed.
All right, so we have just about a minute or so. After the evaluation, how quickly would parents have results?
This really varies based on the provider. Some providers will, you might wait for a little bit, they score things up, they call you back, they give you a verbal feedback as early as that day or maybe within a few days. Some providers wait until the report, which can be 10 to over 20 pages based on the evaluation, until that report is completely written to give you the results, which can take a few weeks to maybe even a month or two.
And then when you get that, then what happens?
Then you can go ahead and pursue services in support of whatever you or your child might need, with a much greater likelihood of having insurance coverage for those services.
All right, so real quickly, if someone thinks that this might be an issue for them or their child, who should they contact first?
Begin with the pediatrician. They, are typically the expert on your child's care. If you have concerns and your pediatrician tells you something like autism can't be diagnosed before the age of 3, that's simply untrue. So call your insurance company and see if you need a referral to pursue an evaluation. You might not, in which case I recommend go ahead and start that process. Many providers have a 1 to 2 year waiting list before they can even start the evaluation. And when you consider that there's a crucial neurological window in the age range of 0 to 3, we really want to get these kids in for evaluations as quickly as possible.
Okay. Thank you so much for your time and your expertise. If you missed any of today's segment or you're looking for more resources, head over to our website, click in the To Your Wellbeing section.